Let's talk about something called the treatment ladder. It's a really smart way doctors handle two super common but kind of confusing leg circulation problems. We're going to break down exactly how it works.
You know that feeling? Maybe you get this nagging ache in your calf when you're just walking around the block? Or maybe at the end of a long day, you look down and your ankles are all puffy. These little things that we often just ignore, well, they can actually be the very first clues to a couple of different circulation issues. So to really get what's going on, picture your leg circulation like a busy two-way street. You've got arteries. They're like the delivery trucks bringing all that fresh, oxygen-packed blood down from the heart. And then you've got the veins. That's the return trip. Their whole job is to get the used blood all the way back up to the heart. Simple enough, right? Well, problems can pop up on either side of this road. Okay, let's start with the down street. Imagine those delivery trucks. The arteries start hitting traffic jams and blockages. That's what we call peripheral arterial disease, or PAD for short. It's really a plumbing issue where these clogs stop enough good, oxygenated blood from getting to your leg muscles, and that's why it can hurt when you walk. So what's the game plan to fix it? Well, doctors use this step-by-step approach, and that's our treatment ladder. The whole idea is to start at the bottom with the safest, simplest stuff first. You only climb up to the higher, more intense rungs if you absolutely have to. So let's start climbing. The very first rung, the foundation for everything else, is all about lifestyle. And I can't stress this enough. Quitting smoking is, without a doubt, the single most important thing anyone can do. It's because you're tackling the root of the problem, not just patching up the symptoms. All right, moving up the ladder a bit. Now we bring in some backup. We're talking medications to handle the bigger picture risks, like statins for cholesterol or antiplatelets, think aspirin, to help prevent clots. Plus, there are special drugs like xylostazol that can actually help you walk farther, and even structured exercise programs that are proven to help your body create its own natural detours around the blockages. Now, what if those first few stacks just aren't cutting it and the symptoms are really getting in the way of daily life? That's when we climb to rung 4, a minimally invasive procedure. The most common one is called an angioplasty. It sounds complicated, but it's pretty clever. A doctor guides a tiny catheter with a balloon right to the blockage and inflates it, pushing the artery open. Sometimes they even leave a tiny metal mesh, a stent, to prop it open for good. And at the very top of the PAD ladder, you have major surgery. A bypass is for those really severe, long blockages that you just can't open up from the inside. It's literally like a construction project. The surgeon builds a detour using a piece of vein from elsewhere or a synthetic tube to create a whole new road for the blood to flow around the traffic jam. This is absolutely reserved for the most serious situations. Okay, let's hop over to the other side of the street. Let's talk about the up-street problem. This is called chronic venous disease, or CVD. And here the issue isn't a clog. The problem is that the little one-way valves inside the veins are broken. So gravity starts to win, blood starts to pool and back up. And that's what causes the aching, the swelling, and those varicose veins you can see. And guess what? CVD has its very own treatment ladder. You'll notice the philosophy is exactly the same. Start simple, start safe, but the rungs themselves, they're totally different because we're trying to solve a completely different kind of mechanical problem. For CVD, the foundation is all about one thing: fighting gravity. Simple things like propping your legs up make a huge difference. But the real cornerstone of treatment, the absolute key, is rung 2, compression. These aren't just tight socks. They're special stockings that act like an extra layer of muscle, giving your veins a gentle squeeze to help shove that blood back up to the heart where it belongs. And this isn't guesswork, you know? This is a surprisingly precise therapy. Doctors actually prescribe a specific amount of pressure, which is measured in millimeters of mercury, or mmHg. For most people dealing with varicose veins and swelling, a Class 2 stocking with 20 to 30 mmHg of squeeze is the go-to recommendation to get things started. But if compression and lifestyle changes aren't quite enough, we can climb the CVD ladder. And this is where modern medicine gets really cool. A super common procedure today is endovenous ablation. It's a brilliant idea. Instead of trying to fix the broken vein, a doctor just uses a tiny fiber with heat to seal it shut from the inside. The body is smart. It just reroutes the blood flow through other, healthier veins nearby. Problem solved. So there we have it. 2 different problems, 2 totally different treatment ladders. Let's put it all together and see what this actually looks like for a couple of different people. This lays it out perfectly, doesn't it? Our 62-year-old with PAD, their journey starts with tackling the risks. Stop smoking, get moving, take your meds. A procedure like angioplasty, that's only on the table if the first steps fail. Meanwhile, our 45-year-old with CVD starts with compression. A procedure like ablation only becomes a serious option if the symptoms are really hurting their quality of life. It's two unique problems getting two tailored step-by-step solutions. So you might be asking, why go through all this trouble? Why have a ladder at all? Why not just jump to the most powerful fix right away? Well, it all comes down to a really fundamental philosophy in medicine. At its heart, that's what this is all about. Every single step on that ladder is a careful calculation of benefit versus risk. The goal is always to start with treatments that are super safe, that actually address the underlying problem and have proven benefits, like lifestyle changes or compression, before you even think about moving on to procedures that, while sometimes necessary, just naturally carry higher risks. And this latter way of thinking applies to so many parts of our health. So next time you're talking about a treatment plan for anything really, ask yourself, is this a ladder? What rung are we on? And what are the steps above and below me? Because honestly, just understanding that there is a ladder, well, that's the most important first step you can take. Thanks.